Janice Fitzgerald, Chief Medical Officer of Health. The Honorable John Hagee, Minister of Health and Community Services, is joining us via Skype from Gander. Please stand by. Our news conference will begin shortly.
Good afternoon again, everyone, and welcome back. We will open up today's media availability with the update today and over the weekend.
Thank you, Premier. Good afternoon, everyone, and thanks for joining us today. Since the media advisory yesterday, we have no new positive cases, and the total number of cases in our province remains at 261. One person is in hospital due to the virus, and 255 people have now recovered. In total, we have tested 12,253 people. Another weekend with no new cases of COVID-19 in our province is exactly what we want to see as we continue to move through each alert level in our plan. Today marks 3 weeks since we entered alert level 4, and our ability to keep the case numbers low during this phase is a true testament to what our consistent and collaborative efforts can achieve. In order to continue to control the spread of COVID-19 in our province, we must stay the course, diligently protecting and supporting one another by following the public health measures in place. As long as we remain steadfast in our determination and focus, we will continue to see the fruits of our collective labor. By now, we have all become very familiar with the tried and true prevention practices we have so heavily relied on to keep us safe. Yet, I am compelled to continue to reinforce these measures at every opportunity because their importance can't be overstated. Please continue to stay at home as much as possible, especially if you're feeling unwell. Maintain a safe physical distance of at least 2 arm's lengths from others while in public spaces, and wear a non-medical or cloth mask when that's not possible. Cover your coughs and sneezes, avoid touching your face, and wash your hands often and well. These simple yet effective measures will literally save lives. Today, I'd like to clarify some parameters around expanding your bubbles. Please keep in mind the purpose of this expansion is to allow each of us to have more social connection while keeping our risk for COVID-19 as low as possible. So you need not expand your bubble at all, or may choose to add only a couple of people. Your personal comfort level will dictate if and how you do this. Keeping your bubble as small as possible serves 2 main purposes. We know that the more people you interact with, the greater the risk of spread of COVID-19. Therefore, the less close contacts you have with others, the better you will protect yourself and prevent further spread in the community. And in the event that you contract COVID-19, the fewer close contacts you have will help public health officials to conduct fast and efficient contact tracing and quarantine. We only have to think back to the large funeral home cluster we had early in the epidemic to see the importance of contact tracing and quarantine in the control of outbreaks. And when I talk about a close contact, I mean people you live with or with whom you've had prolonged contact, usually within 2 meters, for at least 15 minutes at a time. Expanding your bubble means you may add up to 6 people in total to a double bubble. It's not 6 people per household bubble already included in your double bubble. So it's 6 per double bubble total. Before you invite others to join your bubble, I would encourage you to discuss the risks of doing so with other members that are in your double bubble already. So to clarify, I'll give a couple of examples. Jim and Karen live together with their 2 children, and Karen's parents are in their double bubble. Now that they are allowed to expand their bubble, Jim and Karen choose to include their daughter's boyfriend and Jim's parents, totaling 3 people. Karen's parents decide to include their other daughter, her husband, and their grandchild, also totaling 3 people. So Jim and Karen's extended bubble now has the maximum of 6 additional people. Margaret is a senior who lives alone. Her son and his family are in her double bubble. Since Margaret is at higher risk of severe complications if she contracts COVID-19, she chooses to extend her bubble to include only 1 additional person, her best friend, who she plays cards with every week. So other people you add to your extended bubble will likely have their own bubbles already, but you do not need to be close contact with anyone else that's in their bubble. And while your bubbles are connected, they are not completely joined together. As long as you keep the total number of close contacts low, you reduce your risk of contracting COVID-19 and facilitate contact tracing should you become infected. So as we continue to move through each alert level, please keep in mind the significance of 4 important words: people, space, time, and place. Simply put, the more people you interact with, the greater the risk of spread. So please keep your number of contacts outside your bubble as small as possible. Physical distancing is crucial to reducing your risk of contracting COVID-19. Therefore, please be sure your space can accommodate physical distancing. The risk of infection of COVID-19 increases as people spend longer amounts of time together. So where you can, keep your interactions short. And spending time together indoors is more risky than spending it outdoors. So let these be our guiding principles moving forward. As evidence and best practice related to COVID-19 continues to evolve, so too do the actions of our team of dedicated, highly skilled public health professionals. We are constantly monitoring our situation locally, nationally, and internationally, and remain committed to keeping you and your loved ones safe. As we do our part, thank you for doing yours. As a recap for those who may have just joined us, we have no new cases since yesterday's media advisory. The total number of cases in the province is 261. The success we have achieved to date has only been made possible through the remarkable resolve you have demonstrated in containing this virus. Our society has always been defined by how we look after one another in times of hardship, and how we have banded together during this pandemic is just another shining example of the unity and kinship we share in this province. So hold fast, Newfoundland and Labrador, and we will get through this together. Thank you.
Thank you once again, Dr. Fitzgerald, and good afternoon again, everyone. And very pleased, like Dr. Fitzgerald and everyone else, to see that, we started another streak of 4 days with no cases of COVID in our province. And of course, all of us, we will never get tired of those reports. And keep in mind, we've been now literally a couple weeks away from the last long weekend. So once again, the measures that have been put in place, they are working, and indeed, you can be commended for your efforts in keeping yourself, your family, and those around you safe. And thanks again to Dr. Fitzgerald for just clarifying some of the changes that have been made as we expanded those bubbles over the weekend, adding another 6 people for many of you. And always, I guess, it's worthwhile to remind people that if indeed you're not comfortable in going to 6, you don't have to. This is not a requirement. This is just an exercise that you have full control over. So I hope everyone had a great weekend. It was interesting that summer in some parts of the province did decide to show up and pay a visit. And it was a welcome change because it gave people the opportunity to enjoy some fresh air, to get outdoors. I guess June the 1st, so today Parks Canada opened up some of its parks, and in particular that would be parks like Grosse Moorne and Single Hill here in St. John's and Terranova. So Parks Canada, June 1st, opening up its sites. And of course, if you look at their website, you will see that there's a significant number of adjustments related to the pandemic measures. So we'd encourage you to get out, enjoy, but maintain safe physical distancing while enjoying some of the beauty of those national parks. And as the weather gets nicer and people start to expand their bubbles, as been just mentioned, we must always remain vigilant. So it's easy to think that no new cases just happens, that this virus doesn't exist within our province, but we all know this is not the case. It is here. And for that reason, we must continue to work together and do the very best that we can. And as been mentioned, we will keep reminding people, enforcing that one of the reasons why we're seeing the success that we have is simply because people are maintaining good, safe physical distancing, staying 6 feet away, washing your hands, and wearing a mask. One of the things that I noticed over the weekend is that you just couldn't always have the facilities around you to wash your hands, but there was hand sanitizer. People are using using hand sanitizer, keeping it with them, and using that as a replacement. That is always a good replacement, but nothing beats good old-fashioned washing your hands when you have that available to you. So if you take a moment to think about the measures that have been put in place, they are not that hard. They're not that difficult to adjust our life styles to, because they're put in place really to protect you and your families. So as we talk about working together to put a blanket of the virus over Newfoundland, or to protect Newfoundlanders and Labradorians, we will continue always work together to work hard on your behalf and to put supports in place for you. We've already implemented a number of measures to alleviate some of those pressures facing the business community. We know many of them are struggling in our province right now, so we'll continue to work with them and add additional supports over time. Some of those have been the waiver of fees, deferral of fees in some cases, and we've supported, tourism, and many people have reached out and appreciated the work that's been done by the department and by the officials. Also putting a big focus on working with the federal government to support the oil and gas industry, a tremendous job creator and something that has been foundational to the economic stability for Newfoundland and Labrador for many years. And we must continue to work with the federal government to put new measures in place to support that industry. Also today, Minister Osborne announced some additional procurement measures to help further stimulate our economy. And that's been adding some some local preference provisions within the public procurement regulations. And so what it does really is gives us an allowance, a variance for local companies, local suppliers, gives them a 10% advantage if you're a local company. And this allowance is permitted under the Canadian Free Trade Agreement. We always get questioned of where this fits. Other provinces have been able to do put in similar measures, but what we've done now is maximize what's permitted under that agreement. So what this does, it provides local benefits to local suppliers, helps additional economic, taxation, and employment benefits right here for Newfoundland and Labrador. So, bottom line here, this is an opportunity to actually stabilize, create new jobs for Newfoundlanders and Labradorians. Under the agreements that have been put in place, there's always, provisions around open calls for bids and so on. But this gives the opportunity for our local suppliers to give them a leg up in when you're submitting your bids and tenders. So the new thresholds where an open call for bids is required for, our towns, municipalities, our local service districts, academic institutions like our universities, CNA, and so on, school districts, and health authorities. And as an example, where it used to be $10,000, that's now moved up for, just under $106,000. And so this gives, again, some local preference opportunities for, businesses in Newfoundland and Labrador. This is also true not just for municipalities, but also for our own departments and agencies, where you've seen a similar kinds of scale up in opportunities from 10,000 up to 26, nearly doubled or more than doubled. Likewise for services, likewise for construction, and so on. So lots of opportunities here for local companies to actually take advantage of those new procurement regulations that have been put in place. We've extended that also to the Crown corporations within our province, and you'll see the numbers even a little larger there. But keep in mind that there's always an opportunity here for, this is not about openness and transparency. We will continue to put that lens on all that occurs here so that companies all get a fair opportunity to tender on work that's been done by government. The goal behind all of this is to give our local companies a bit of a preference so they can create more benefits for Newfoundlanders and Labradorians. Also, it's important in all of this, it gives the construction season, which is very short in Newfoundland and Labrador, it gives them an opportunity to get started a little sooner. As you know, we've put out tenders and awarded some tenders in the last coming weeks, and we know that there's many more to come. And again, this is about re-stimulating and stimulating the economy and providing jobs. So these are just examples of the supports that we've put in place, adding more efficiency to the procurement process, but also gives us the flexibility to support our local enterprises. It gives them, as I said, opportunities to procure a number of local things from our local economy. And added to that, we know that there's probably some more opportunities that we'll need to put in place. So we're also adding some of the key ministers that we have within our government to put in place a committee, give them 6 months to review regulations, legislation, policies, start reviewing this immediately, report back in 6 months. But also what's extremely important is to put in place a consultation, a level of engagement with our local business community. So the hope is that these recommendations will lead to permanent changes and translate into even greater opportunities for businesses throughout Newfoundland and Labrador. So speaking of changes, next Tuesday, June 9th, you'll see the House of Assembly open up. There's some legislation that we need to work on On behalf of Newfoundlanders and Labradorians, the Assembly will look quite different. There will be a limited number of members, on the floor of the House of Assembly. And of course, this is all in keeping with the new rules around pandemic, keeping safe, physical distancing, and so on, in what is, as we keep saying, a new normal. So all these changes that we've announced today, changes in the House of Assembly, these are all efforts that we're putting in place to help our legislators, help the business community to develop solutions aimed at rebuilding our economy. As Dr. Janice Fitzgerald just mentioned, we're 1 week away from moving to alert level 3 in our plan for life with COVID. This is where you'll even see further steps to gradually reopen more businesses and settle into another phase of living with COVID in our province. All of this comes down to working together to move Newfoundland and Labrador forward during this pandemic. And we have made great success, and you deserve the credit for the progress that we've been making. So let's keep up the momentum. Let's be determined. We are moving in the right direction. So if our recent results are any indication, we all know that we can do this. So with that said, I thank you for this opportunity again today, and I will now pass it over to the Minister for his comments for this Monday.
Thank you very much, Premier. And again, 0 is a great number, straight line, and shows that the measures that we have all struggled to keep up with some days have actually worked well and served us well. Before I open my rest of my comments, I'd just like to recognize it is the start of Brain Injury Awareness Month in Newfoundland and Labrador. And over the coming few weeks, I think we'll see some activities virtually on behalf of that group and their members. From the point of view of events within the healthcare system, I think it's noteworthy to mark the opening of Western Long-Term Care, which is the new facility in Corner Brook, completed through a partnership, a very successful one. And we are starting to admit patients to that facility as of today through Western Health. With the foresight of infection and prevention control planning, each of the rooms in there is totally COVID-friendly and is built to the highest standards for palliative care, rehabilitation, and long-term care, which is what the focus of that building will be. And it brings with it new jobs and economic stimulus to the area. It's another jewel in the crown of Western Health. Not far behind that is the increase in bed capacity for the protective care unit at Botwood. The two centres in Grand Falls, Windsor, and Gander are on track, and they will in turn build on the style and success of Corner Brook. And Green Bay Health Centre is on track to open on time too. So again, stuff that may have kind of fallen by the wayside in the public imagination is important as a sign that the healthcare system is still there and still needs to function under non-crisis kind of conditions to deal with the everyday challenges that we meet. You heard Dr. Fitzgerald discuss the enlarged household circles that have seemed to create both opportunities and confusion. I think the key word from her point of view is this is optional and it should be thought out, as Dr. Rahman provided the rationale for that last week, showing that if a household can keep its outside contacts down to less than 6 strangers or outsiders, shall we say, over the course of a typical day, the risk of COVID transmission remains low, given our low prevalence of the virus here. So again, the measures that we've gone through and sustained for the last couple of months have served us well. Level 3 is coming up, and at the moment, if we carry on with this trend, we should be well positioned to start that next week. But again, I go back to the comments of Dr. Fitzgerald today and on a previous presentation, that this is about people. It's about keeping the numbers you interact with low. It's about space and keeping adequate distancing, and that has certainly served us very well and will remain the key to controlling COVID over the months and maybe years we have to live with it. It's also about time, keeping your exposure with people outside of your household circle as short as you can reasonably do it. And it's about recognizing that outside activities and interactions are by and large safer and less hazardous from a COVID perspective than indoor ones too. So again, look after your household circle. Don't jeopardize anybody else's personal space. If you can't distance, wear a mask and keep up the good work, Newfoundland and Labrador. Thank you, Premier.
Thank you, Minister. And of course, yes, reminder that the long-term care site opening up in Cornerbrook, and this is all part and parcel of the healthcare infrastructure that we've been able to continue to, work on during this pandemic. But also reminder that the staffing at those new infrastructure, healthcare infrastructure, will be done by public sector workers. So we'll now turn it over to the media for today's availability.
Thank you, Premier. For the benefit of our speakers, we have 7 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Please do not press *1 until your name has been called. Following this, should time permit, there will be an opportunity for single questions. Our first questions today are from Peter Cowan of CBC News. Please go ahead.
My first question is for Dr. Fitzgerald. You've had the recommendation now for a little while that people should wear a face mask if they're in somewhere like a store where you can't maintain that physical distance. Most people continue to not wear face masks when they go to the store. How concerned are you about this?
So I think at the moment, the recommendation is if you cannot physically distance, to wear a face mask, a non-medical mask. I think I would hope that people will start to think about that. I know it can be difficult. They're warm and it's hard to breathe when you're inside, and if you're wearing glasses, your glasses can steam up, but there are ways that you can remedy that. We have to think about this in terms of protection of other people, and that if everybody is doing it, then it protects all of us. So I think we need to keep reinforcing that message, and we do recommend that if you're in a situation where you can't physically distance, and especially as we're coming up onto level 3 and we're thinking about public transportation, for example, and people on Metrobus, is something that comes to my mind right off the bat, that you think wearing a non-medical mask in that situation when you're in contact with each other for a short period of time would be beneficial.
When you look at the makeup of the daily briefing, all 3 of you have medical backgrounds, either physician or Premier as a pharmacist. How do you respond to the criticism we've seen today from the Employers' Council that while you've done a good job of attacking this pandemic from a health perspective, you're not taking into account the economic perspective and the hardship that these measures are creating?
Well, I think in actual fact we do take into account, and all of us as various backgrounds, we're all consumers of products and services within our province as well. So given the fact that if you actually secure the pandemic as it is and keep the cases low, move into your plan, put your plan in place, move into it, and strategically open up those businesses. There's a number of preventative things you can do. You can imagine if you had to go back from alert level 3 to alert level 4, the non-confidence that would put through our community. And that's not to say that will not happen. That's actually happening in New Brunswick as we speak. So right now, this is really about making sure that we strategically open up this province and making sure that we're prepared to respond to a setback. And so it's a small province, and we have a limited number, of people that live here. We have a lot of vulnerable people that live in Newfoundland and Labrador. So the important thing is now, when we're ready to open up, we must open up, but do it safe. Do it only when it's safe. Do it watching where the virus is around us, not just in Newfoundland and Labrador. Our intention is to get services opened up, but we must do it when it's only safe to do so.
And Premier, with the announcement that the legislature is going to open in just over a week, what are your priorities? What are some of the specific pieces of legislation that we're going to see debated? Yeah,
there's 3 or 4 pieces of legislation now that we're looking at, and which should be prepared next week. The House Leader is working with the other 2 House Leaders that we have within the the official opposition and the third party. So there'll be at least 4 pieces of legislation and potentially more. So you probably see about a couple of weeks in there that'll start on next Tuesday, but a very different looking House of Assembly next week.
Thank you.
Our next questions are from Tyler Dunn of VOCM News. Please go ahead.
Premier, what do you say to those who believe the rent relief program isn't really helping small and medium businesses and it's the tenant who should receive the benefit rather than the landlord?
Well, the issue here is about, making sure that, the rent gets paid. The other thing is to make sure that people do not get evicted. Yeah, so this is really about working out a situation where the rent is, where someone is behind on the rent, let's say the tenant, that the landlord would get paid. So what we're seeing here, we're seeing a combination of a number of things. A number of landlords that do not want to give, want to forgive 25% of the rent to secure the 75%. And right now we see some tenants who would really like to be able to take that money themselves, and then there's really no provision in all of that would actually go to the landlord. So it's a difficult situation. We know there's a number of people out there that are looking for relief. There's some relief there now, as we said, that's in place, but it's a requirement there that the landlord must reduce its rent by 25%. The tenant would be only responsible for 25% of the total amount, and a combination of the federal and the provincial government would pay the remaining 50%. So it's a program that's available out there for those that want to receive it. Criteria has even been changed and amended since that. So if anybody is looking for rent relief and they can find a combination of working with their landlord, well, then support is there.
Thank you. And with bubbles being expanded over the weekend, like you talked about in the beginning there, and with many households and individuals now merging, is there any way that this can be enforced?
So this is not an enforceable thing. We're asking that people use their common sense and good judgment, which I think abounds in this province. So, we're asking them to make their decisions based on the best evidence that we've been able to provide, along with what they feel works well for them and their family and their contacts. So, but with regard to enforcement, these are guidelines and recommendations, so there's not enforcement for that.
Okay. And plans for peaceful protests in St. John's are brewing on social media for later this week. What advice or concerns do you have for people who plan on attending something like that?
So with regard to mass gatherings, there are rules in place for that, so people have to bear that in mind. If there are ways to protest safely, I would certainly urge people to consider that.
Okay, thank you.
Our next questions are from Elizabeth Witt of All Newfoundland Labrador. Please go ahead.
Thank you. Can you hear me now?
We can.
Hello? Yes.
Perfect. It's been 2 weeks now since the May 2-4 weekend, and I was wondering, is it now safe to say the province is kind of in the clear in regards to any new cases stemming from that holiday?
So certainly we know the incubation period is 14 days, so I would never venture to say that we are in the clear. There could be people who've been brewing symptoms for 3 or 4 days that we don't know about yet, but certainly there doesn't appear to be a large number of cases that have resulted from activities on the May 24th weekend. But I would never jinx it to say that we were in the clear.
Right on. All right, and it's now a week until the province is expected to enter alert level 3, and I know we had a new case a few days ago, but I'm curious, what would it take to derail those plans now?
At this point, it would take a significant number of cases, a rapid increase in the number of cases, and especially cases that do not appear to have a source, so what we call non-epidemiologically linked cases. So that would be a case that's not related to travel or not related to another case, or we couldn't find what the source of that infection was. We would have to have, several of those before we would think about changing those plans at this stage.
Right. And earlier today, Minister Osborne announced a local preference for when it comes to procurement bids, And I've heard people say that the definition of local company is it's really broad. They have a local presence, they hire local, and they pay some local taxes. And I was wondering, Premier, how do you respond to that?
Well, what this is a way to stimulate and get some more products bought and chopped here locally, and this is really a concept that we want to take not just for government, but we encourage our local residents to do the same. This is a way we know that many businesses within Newfoundland and Labrador, as they've been hit pretty hard during this, and many businesses on the east coast of the province even coming through Snowmageddon. So this has been a pretty tough 6 months for people in Newfoundland and Labrador, especially those business owners. So this is a way to actually put in a little bit of a preference, which we're allowed under the Canadian Free Trade Agreement, and encouraging people to, as government, we would encourage people to shop local, and this is a way that we can actually provide some leadership in making some more local investment ourselves.
Thank you. Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
The Liberal leadership race will begin on Monday. Eventually, that means that we'll have to go to a provincial election because of the electoral laws here that say that within 12 months of a new leader being chosen, we have to go back to the polls.
That would need to take place with all parties and all potential candidates. So we're quite a few months away yet before we plan for a general election. And the Liberal Party now are making provision for the leadership race, which will be done virtually. So all of this must be done safely. It must make sure that we follow public health guidelines, but keeping safely front and center of any election, regardless if it's the next leader as a successor or if it's a provincial election. And we'll see this all unfold in a lot of jurisdictions over the next year or so. So there'll be lessons learned from quite a few people, and yet we must be able to respond and make sure we put a safe process in place.
There was $2.2 billion of federal funding for municipalities that was announced today. Do you know how much Newfoundland and Labrador municipalities are going to be getting?
Yeah, I don't know the exact amount of that now, Patrick, but what I know, it's a one-time payment. And this is really meant to stimulate and get the money in the system as quickly as possible. All of this is really about re-energizing the economy, getting people back to work, and getting access to getting some of the infrastructure that's needs replacement. So this is really about stimulating the economy, getting the money in the system faster, creating jobs for people in our province. But what the exact amount is, I can get for you for our province under this current program. I wouldn't have that information here with me today. Okay.
And Dr. Fitzgerald, during a briefing last week, you asked anyone who was on Air Canada Flight 8018 on May 22nd to call 811 and to come forward to get tested. Just wondering what a bit of a processy question here. Why would people have been contacted by public health directly, given you would get that contact info through declaration forms? Just wondering why was that announcement or that request made at the briefing and not in the way I was just talking about?
So public health can actually contact those people, and we're aware of them. And that happens at a regional level, as far as I know, but we just wanted to make sure that we got that message out to everybody.
The next questions are from Kellyanne Roberts of NTV News. Please go ahead.
I'm getting a lot of messages in terms of the clarification on bubbles. I'm just wondering if you can go over that again. Sorry. It's sounding like if I joined a household that was a part of a double bubble, I don't join their other double bubble.
Okay.
Sorry.
No.
I got to talk about John and Karen again.
See this. I don't know. No, you can't. All right. I had a diagram drawn out. I thought you might be able to see, but I don't think you can. I don't think it's dark enough. But basically, if you have a family and there's somebody, you have your double bubble, and my eldest daughter wants her boyfriend to be part of one of these extended contacts. This is just an example. But if she wants him to be a part of that extended contact. So that means her and her boyfriend are close contacts. He is a close contact of us because he'll be coming into our household, obviously. She will be a close contact of his household because she'll be going into his household. But other than her, the rest of the people in our household will not be a close contact of the rest of the people in his household. So that's the difference. So if we had to do contact tracing, if somebody in my household, heaven forbid, got COVID, then, while her boyfriend would be considered a close contact of us, his family would not necessarily be, right? So it makes it just reduces the risk of spread through that, but it also, when it comes to contact tracing, it reduces the number of close contacts that you have. So the quarantining process is easier, it's quicker, and it really helps to reduce that risk of spread. So, and nobody in our double bubble would be considered a close contact of her boyfriend because he's not interacting with them on a regular basis. Even though he has entered our bubble, he is really only a close contact of our immediate family, right? So there's levels of contact within these double bubbles, and that's what we're trying to reinforce here is that even though some people may have close contacts outside of their double bubble, it doesn't mean that everybody inside that double bubble has have a close contact with that person. And we're asking that double bubble to limit that with 6 people in total. And I know it's a bit confusing, but for now, you just really what you have to remember is that you can have an individual from another bubble be your close contact, and that still doesn't increase your risk as much as if your bubbles completely joined together like your double bubble did. I don't know, I may have made that more confusing.
It was more clear to me that way around, but I'm not sure for everybody else. But anyway, thank you, I really appreciate that. Looking like level 3 will happen next week now, is there any indication that we've determined a timeline for how long we'll be in level 3?
At the moment, we're going to wait and see what happens as we move through level 3. There's going to be a lot of things opening in level 3. There's going to be a lot more movement in level 3. We're going to see sports to some degree restarting in level 3. So I think we really need to wait and see what the effects of that opening will be, and that will, as we said, we have this surveillance strategy that we're using, that information that we get from that will help us to determine how quickly we can move through that level 3.
And is there any more clarification on what sports will be opening in level 3?
So those conversations are ongoing. At the moment, it's going to be what we call moderate risk or medium risk sports. So where you aren't, there may be some interactions with people, but certainly not heavily contact sports at this point. But those conversations are ongoing at the moment.
Thank you.
Our next questions are from Abigail Wellman of CFBS Radio, Blanc de Blanc. Please go ahead.
Good afternoon. This question is for Premier Ball. The Quebec government has decided to remove its Quebec-Labrador border checkpoint as of this morning. However, the Labrador checkpoint is currently still in place at the border. Is the government of Newfoundland Labrador considering to remove this checkpoint in the near future to allow travel across border for shopping, for example?
Yeah, so there's been a very tight relationship and over the years, both family and commercial related. So these borders have been almost in existence for years, even though they were never very strong borders. So people move freely across those borders for many, many years, as you know, Abigail. So right now, it's we still have the OPP. I think they're moving out of there. They'll be taking their presence on those borders, both in southern Labrador and in Labrador West. So that's the indication. So we're working with the RNC, working with community leaders, because we must get an understanding now of where our local leaders would be. So there was some discussion this morning. There'll be another meeting, I know, tonight. And I know later this week I'll be speaking to all the Labrador leaders as well. So, we'll make sure that we put, what's in place to benefit Newfoundlanders and Labradorians working with the public health officials, of course, but making sure that we protect Newfoundland and Labrador residents as best we can, but yet with an understanding that this relationship has been there for many, many years. And we would like to be able to get back there, but we must only do it when it's safe. We know that Quebec's in a much different situation that we are into, but recognizing that the southern border and the Lab-West borders are very different than what we're seeing happening in other parts of Quebec.
Thank you, Premier Ball. My second question is for Dr. Fitzgerald. With residents of Newfoundland, Labrador now being able to travel within Quebec, if people come to Quebec from, say, southern Labrador to shop maybe across the border, what are the current health requirements for them when returning home from our province?
I'm sorry, what are the requirements of?
Like per se, would they have to quarantine, for example, because they crossed the border?
Would somebody from Newfoundland and Labrador have to quarantine because they cross the border into Quebec? Is that what you're...
Yes. And then returning back home to Newfoundland or Labrador.
So right now, the orders are in place for those communities that are closely knit together between the Quebec and Labrador border, that they would be able to move back and forth to do those essential things like for work and for healthcare, for school, because there are some students who are going to school in Quebec town. So, that movement is able to happen without the isolation requirement. If somebody from Newfoundland and Labrador in general went somewhere in Quebec other than in those border towns, then and came back, then yes, they would be required to isolate.
Okay, thank you very much.
Our next questions are from David Marr of The Telegram. Please go ahead.
Hello, yes. I'm wondering what given the situation that we're seeing that's continuing to unfold in New Brunswick, what is the healthcare system's capacity right now to pick up on an outbreak right now? Are you kind of relying on people reporting to 811 about symptoms, or how quickly can we stamp down the next outbreak of this virus?
So if we found out that somebody tested positive for COVID-19, obviously contact tracing would start immediately. If we found out through the process of that contact tracing that there was work-related exposure or exposure in a healthcare facility or in a long-term care facility or any other sort of residential or close working arrangement, then we would do the investigation as need be. So all close contacts from those facilities or workplaces would be traced as well, and they would be advised to quarantine. They would be tested. So, I think at this point our public health capacity is good to be able to respond to any cases and any outbreaks that we would have.
So, David, just to expand.
David, I think.
Then just to expand on that a little bit there, David, is if you look at, I guess your question would be, this is one of the things that we always look at, or through the Department of Health and Community Services, along with public health, is what the capacity is, and this must always be something that's front and center in decisions. And so currently, as of today, the department keeps track of all of this. There's some 65% occupancy, so there's room within the system itself. It's not to say it would ever go anywhere close to 100%. I think you've heard the minister talk about a 75% range. Within ICU in a province, there's only one, and the ventilator capacity, which you'll see is a topic of discussion amongst a lot of media outlets nationally, is at 14% within Newfoundland and Labrador, and that's on average within all the regions. So everyone's keeping a close eye on this. I know the minister follows this on a daily basis, and he'd probably be able to have a little more to say about this.
Thank you, Premier. My comments were twofold. You've mentioned the figures from the healthcare system capacity. I think the other takeaway is from Dr. Rahman's presentation last week about contact tracing and the rapidity of it. And I think Dr. Fitzgerald is a little bit modest around public health in general in this province and its ability to respond. If you look at Dr. Rahman's comments, to get an outbreak or a center under control, you need contact tracing within 48 hours. And he suggested that you were looking at 60 to 70% of contact, if traced within that time, would limit the spread. We have done better than that. And in actual fact, if you look at, for example, the calls cluster, those figures for contact tracing there were well over 90%. So I think we're looking at prevention. That's been the thrust of these talks every day. How you keep people following the holy grail, as it were, of distancing and limiting contact. But if you actually have to respond, we have a very robust front line, which is public health. And behind that, the backstop is we still have capacity within the healthcare system. Our challenge now is to figure out how best to use that capacity to deal with some of the challenges from the backlog that we've seen since March the 18th.
Thank you to all three. And I guess also looking at what's happening in New Brunswick, I know it's still early days in that situation, but we'd also had some early discussions about an Atlantic Canada-wide bubble. Does the situation in New Brunswick kind of put the lid on any of those discussions?
So one of the things about the Atlantic Canada bubble, David, I will say that there's a lot of discussion through the media and outside of the Premier's tables. We very rarely, as Premiers, talk about this. This is something that, there's been a level of interest and we've had some discussion on. But we must, as I say, we got to be able to and must be able to move around our own province safely first and be cognizant of what is happening in other provinces. So right now, there's no question there's a bit of a spotlight on what's happening in New Brunswick. But once again, it's a reminder of what can happen. And, that's not just, exclusive to New Brunswick. That could actually happen right here in Newfoundland and Labrador or in Nova Scotia or in PEI. So what we're asking for people is to use, as Dr. Fitzgerald said, use your common sense. Be responsible. If you're traveling, be extra, careful when you come back to our province. If you see symptoms or something that you need to report, get tested and so on. This is really about living with COVID in Newfoundland and Labrador. The Atlantic bubble is something that could be looked at well into the future. It's not for now, but because first and foremost, we must be able to move safely around our own province.
Thank you again, and I'm just wondering if there's any update on the contact tracing app that's being developed. Is there any timeline as to when that might be released publicly?
I guess all of us, to some degree, have had some involvement in this. I think what's becoming very clear, even nationally right now, that the app is a nice to have, but the most important tool that we would ever have available to us, seemingly right now is as the minister just mentioned, a great group of people available to actually do proper contact tracing. We've got a good group of people here throughout the regions that are ready and available to be able to do that. From a national perspective, there's other resources that the federal government can bring to this, but seemingly there's more of a discussion now as opposed to an app, what the program would look like beyond the contact tracers that we would have available to us in our province and what mechanism they could actually provide by going out and adding those measures in place to support the contact tracing that we have in our province. So having the app, it's not something, unless you get to a certain percentage of the population, would be as successful as a lot of people thought it would in the beginning. But right now, we see Alberta have tried this to a limited degree of uptake within their community. I know New Brunswick has been tinkering with this a little bit. But right now, I think the real solution comes down to having good, strong contact tracing in place, which we have in Newfoundland and Labrador, but also having the support of the technology and a program to support this tested contact tracing that's already available to us.
Thank you very much.
Thank you. We have time for two quick questions, so I ask the reporters to press star one, and operator, if you would identify them, please.
Thank you. The first question is from Kellyanne Roberts, CTV News. Please go ahead.
Thanks. At what level are essential workers who normally work able to go back to working both jobs?
Kind of lost you, Kellyanne.
Oh, sorry. wondering at what level essential workers who normally work second jobs are able to go back to working both jobs.
So that's not a discussion I think that we've had so far. We recognize the importance of, I think what you're referring to is probably a decision that we made around long-term care workers that were working in multiple sites. And so the decision there was made to restrict people from having that second job, just, stick to that one location. We did that. That decision was made through public health simply because we know that they actually provide care for the most vulnerable in our society, our seniors that we're talking about in long-term care or within personal care home situations within Newfoundland and Labrador. The whole idea there that you would not be, if you were a healthcare worker that got impacted or came in contact with a senior at another site, that this would not be brought into, and you'd have multiple sites infected. So this decision was put in place a few weeks ago. It remains in place for that very same reason. This is to protect the most vulnerable that we have in our society. We've seen what's happening outside of Newfoundland and Labrador. We've had, some positive cases in some long-term care settings in our province. So recognizing that it's the most vulnerable, and when you think about the statistics that are happening nationally, it is that age group that is getting impacted disproportionately in every other jurisdictions. We do not want that to happen in Newfoundland and Labrador. That's the reason why these decisions were made.
Thank you.
And our final question today is from
Peter Cowan, CBC News. Please go ahead.
Premier, parents have been told that as long as they're able to work from home, they can't make use of their regular child care. In some households, we have one parent going back to work next week, leaving one parent who ends up then having to look after several children while essentially making it impossible for them to do any work from home. Why not allow anyone who needs it in order to access child care?
Well, right now, we want to work with families. We've extended, as been just mentioned there late last week. On Friday, we mentioned that the child care program for essential workers would be extended now till around June the 26th. This has been a big investment that we've made to our essential workers within Newfoundland and Labrador, and it's been, when you compare this to what's happening in other provinces, this is one of the best. So, these discussions will continue, and, you've given us examples where people cannot, do the work that they would require at home. But, most people that do work at home, they have the full day to be able to put that work in place, and therefore, services could be provided for the second period once their job is done. So there's a number of different circumstances that we will need to be able to look at. But, keep in mind that in, June to 26 is usually when school would close in other years as well. So, we're going to continue to work with families. And if this puts undue pressure, well, it's always, room for opportunity to review those programs.
Thank you.
Thank you very much. The time for questions has ended. Please join us again on Wednesday, June 3rd at 2 p.m., 1:30 in most of Labrador. Have a great evening, everyone.